Today's video is about OET listening. You have probably watched 10 videos on OET listening by now, some with tips like practice more, listen actively, and underline keywords. But you are still stuck, still unsure, still hearing that accent and thinking, wait, what did she just say? Well, guess what? Today we are just going to throw all the usual stuff out the window. This is not your typical listening strategy session. I'm gonna give it to you raw, real, and ridiculously practical, just like how you will experience it on test day. So grab a notebook, get comfy, and let's decode OET listening like never before. Let's start with the real problem. Everyone thinks listening is about yours. No, listening is about your brain. Your ears just receive the sound, but your brain decides what matters. And during the OET exam, your brain is under pressure. It needs to decode the accents, medical terms, emotions, and timing all in one go. So let's break this beast into three parts: part A, part B, and part C. And for each, I'll give you real time examples and what to actually do, not just listen carefully. Part A, consultation extract. All right, so this part sounds easy. Between you will hear two short dialogues between a patient and a healthcare professional. You just need to fill in the blanks, right? Wrong. Here's what no one tells you. Patients don't speak like textbooks. They ramble, they hesitate, they give half information. And guess what? You are supposed to grab the exact wording for the gap while the patient is still talking. Let me give you a real time example. Here is the scenario. It's just an imaginary. So the patient is saying like this. So yeah, I have been having this weird kind of, I don't know, like tightness. It's not pain exactly, but it gets worse if I walk too much, especially uphill. It's been happening for a couple of weeks now, and I'm getting worried it might be something serious. And the doctor is telling, okay, so intermittent claudication symptoms for about 2 weeks, aggravated by exertion. And your blank might be symptoms started approximately dash ago. Now, if you were waiting for the patient to say symptoms started 2 weeks ago, forget it. That never happens. You need to train your brain to filter messy speech into clear answers. Let me tell you the strategy for that. So don't just listen. Pre read your questions fast and predict the kind of answer that fits each blank. What is the time? What is the condition? What is the drug name? What is the quantity? Once your brain is on alert for timeline words, you are halfway there. Okay. And the next strategy is you have to write fast, but don't panic about spelling. If it's a clear medical term and you misspelled it by one letter, chill. You don't lose marks for that. But if you panic and skip a blank, that's what cost you. Okay. Practice hearing what's not said correct. Practice hearing which was not said directly. If the patient says, it started last Monday, your answer is 1 week ago, not Monday. See the difference. Okay? So make a shorthand legend before the test day. For example, YRS for years, BP for blood pressure, and HX for history, WKS for weeks. So this will save you crucial seconds. Now let's move on to our part B. Let's talk about the middle child of the listening test, part B. You get six short audios. Each one is around 30 to 45 seconds long. One speaker, one multiple choice question with three options. Sounds simple, right? No, that's the trap. Part B is short but fast and sneaky. The hidden danger in part B is all three options usually sound believable. That's the trick. You will hear option A words in the first sentence, option B in the middle sentence, and option C right at the end. So if you are just playing find the keyword, you will get tricked every single time. Okay, so let's see an example here. You'll need to complete the triage form first. Once that's done, send the patient to room 3, where Dr. King will do the physical assessment. If she thinks it's serious, she'll immediately alert the cardiology team. And here's your question. What is the nurse instructed to do? And you have three options here. Option A, alert the cardiology team. Option B, complete a physical assessment. And option C, fill out a form and refer to the patient. Now, the correct answer is option C. You will hear all the three actions in the clip. The trap is who does what. The nurse fills the form and sends the patient. It's the doctor who may call cardiology. So, your job, you have to track the roles, not just actions. Got it? And let me give you some of the strategies that you need to follow in part B. Focus on the speaker's role, who is talking and what is their job, whether the receptionist is talking or what is the receptionist's role, and the nurse, radiologist, that context changes everything. Okay, and don't rush to answer just because you hear option A mentioned first. Many students hear something and pick it on reflex, but the speaker might go on to correct themselves or shift the meaning later. So, the real tip here is the right answer often comes last. Seriously, be patient. Okay. Third strategy is tone matters, tone and intention. You might hear subtle cues in the voice like hesitation, urgency, frustration. These emotional signals help you detect the intent, especially when deciding between should and must or recommended versus mandatory. Okay, look for the tone and intention. So, practice with the speaker role mindset. You have to ask yourself, is this person giving instructions? Or are they reporting something? Are they clarifying a misunderstanding? That frame helps you filter the noise. Okay, now let's shift gears to part C, long discussions, real thinking. This is the big one. Too long recordings, healthcare related topics, different accents, no transcript, just you, the voice, and the timer. You will hear interviews, presentation, panel discussion, or expert commentary. And here is the kicker, the answers aren't sitting on the surface. You have to infer, analyze, sometimes even disagree with what's said. Here is an audio, I'll just say it for you. We initially thought the new handover protocol would improve efficiency, but we found that the staff were actually spending more time checking notes. It made them feel more thorough, but it did not translate to quicker patient care. That was unexpected. And here is the question is, what is the speaker's attitude toward the new protocol? And the options are it has failed to meet expectations, it has greatly improved care, it has reduced staff stress. And the correct answer is option A. It has failed to meet expectation. He never says it failed. He just explains a surprising outcome in the neutral words. And this is where most candidates freeze. Got it? And when it comes to strategy for this part C, here you are not just listening to facts, you are listening to opinions. So try to answer these in your head while you listen. So, does the speaker sound happy or doubtful? Are they excited or disappointed? Are they promoting something or criticizing it? You need to look for that. And the next strategy is eliminate extreme or out of scope options. When you are in doubt, knock out the most extreme or off topic option first. Most questions have one clear wrong choice. Always find and delete that first. Then, keywords. Okay, keywords lie. Just because you hear a word like stress doesn't mean the answer is about stress relief. Focus on the message, not the vocabulary. So in part C, assume that the answer will never be said word for word. It's like interpreting between the lines. If you're expecting direct answers, then you will get stuck. Alright, that's all for today's video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye bye.